Hello, everyone. This is the first academic session for First International Kinesiotaping e-conference. She is among the oldest certified kinesiotaping practitioner in India. She is also the certified manual therapist with extensive 11 years of experience clinically as well as in sports physiotherapy after her post graduation. She has been associated as a team physio with Indian women's football team, India Red Women's Cricket, India's Women's IPL Trailblazers. She has been working with various cricket associations and as a mentor in SPAA India. I formally invite Dr. Khyati Sharma, and today's her topic for lecture is benefits of kinesiotaping as a sports injury treatment and preventive measure. Over to you, Dr. Khyati.
Okay. Okay. Good morning, everyone, and hope you are doing well on this Sunday morning. And I'll make sure that you are not bored with my lecture, and I'll keep you, entertained during this pandemic. And hope you all are staying safe and taking care of your loved ones. And I'll begin today by thanking Dr. Kenzo Kase, who has invented this wonderful tool for all of us in the field of sports physiotherapy and also general population, which I have been using for last 9 years and collaborating it with my other skills, and it has helped me a lot. And before I move further, I should thank my mentors, Mr. Ginu NG and Dr. Gracie Forrester, taught me the basics of kinesiotaping during my sessions in Singapore, KT 1, 2, and 3. And I'm trying to follow their footsteps the way they taught me. And it was the way they taught me, it was actually engraved in my mind. I never needed to go back to my books. And they made it so simple for me to understand. And that is how I'll try today to make it simpler for you. And I invite you all for this e-conference, first kinesiotaping e-conference 2020. Okay, now let's moving on to my topic for today, which is benefits of kinesiotaping in sports injury treatment and prevention. First of all, why I have chosen this topic is because I feel lots of people, they are not aware of the uses, benefits, and how you can use kinesiotape, in sports injuries. What I've come across, people always feel it is just for prevention or maybe some sort of treatment, or maybe they can use it just, for minor injuries or so. But after this session, you might find it very useful during the injuries and initial rehab stages, later rehab stages, and also I have used it for hairline fractures as well. Yes. Okay. Now, first of all, I'll discuss the physical benefits of kinesiotaping. First and foremost is the pain relief, and it works on mechanoreceptors and nociceptive receptors. In lifting of the first layer of the skin, and allowing the lymphatic and blood circulation, and thereby removing all the substances which cause pain and inflammation, and reducing the pain, and also relieves muscle spasms and gives the muscle the space to move around. And it will be discussed today extensively in another session, so I will not go into the depth of it. And now, it accelerates the recovery from bruises and contusions, prevents or relieves muscle spasms and cramping. Definitely, it works in case of calf muscles, which is quite common in hotter climates. It speeds up the recovery of overused muscles, as in the trapezius muscle. Many players, they come up with it like they have trigger points, they have a lot of pain in trapezius area, and also I've used it for subscapularis as well. And next is it supports injured muscles and joints without restricting the range of motion. Yes, this is the most useful tool of kinesiotape, because what I have seen is, like, usually when they have muscle strains, so it doesn't restrict the range of motion, it allows the full movement of the joint, and thereby preventing the muscle from getting strained further. So I personally use inhibition technique of muscle for this. which is very useful. And I'll be discussing that later, that how you can use the facilitation and inhibition accordingly. And as I said, improved lymphatic drainage, which will help in minimizing the swelling and bruising of the treated tissues. The enhanced blood flow to the injured tissues supports more rapid healing. And it lifts the action of the tape. Like lifting action of the tape is for, decreasing the pressure on pain receptors and making both the injury and the effect of treatment less painful. Like we have got a lot of layers, so it lifts and it allows good lymphatic drainage and blood circulation. And it provides a support for injured muscles or joints while allowing a full, healthy range of movement, an important component in rehab. Specifically, I have used it in the cases of ankle injury quite a lot. This is what I was telling about, as you can see in the picture. Kinesio tape, text tape, we usually put it on the superficial layer, and how it lifts the skin and it allows this space to be created for the muscle and proper lymphatic flow. As you'll be doing your courses of KT 1, 2, 3, or maybe if you have done it already, you must be aware of all this. That is how it works. And there is this study. The superficial facial layers of the body are more densely populated with mechanoreceptors than tissue situated more internally. So it is now believed that joints only provide joint feedback when at end range of movements and not during physiological motions. So what you can use the kinesio tape as, you can, reduce the end range of motion, which causes complete stretch of the muscle. That is what we work on, like reducing the, flexibility of the muscle by 10 to 15% if you're using an inhibition technique. I'll repeat, only in inhibition technique, because there we use the complete stretch of the muscle, of the tape, I'm sorry. And in facilitation, we are only going for 15 to 20% of the stretch. And this is how it is. This is another study which was done in 2003, like how the tape works. It manipulates with the tissue and it produces some soft touch and shear effect. And there is stimulation of mechanoreceptors as we just discussed. And then it sends the signals to the autonomous nervous system and it relieves, the mechanoreceptors, and there is good lymphatic drainage and blood circulation, therefore causing the intrafacial smooth muscles to loosen up a bit and the tissue response is better. That is how it works. And there are basically four major functions of the kinesio tape. Number one, it supports the muscle. It removes the congestion. In case of some swelling in calf muscles, it is quite useful in, this varicose veins. I have used it personally, but with caution, because many people with varicose veins I have come across, they have some hypersensitive skin. So, for that, you have to do a patch test, which is very important. And I would suggest you to always go for a patch test or take history from the patient or the player if they have any skin allergies or anything. What you can use is, you can use the ventral area of your elbow for that. And you can go for a 6-hour patch test, if not 24 hours. And it corrects joint problems, as in the case of chondromalacia patella or patellar tracking. You can use it intensively. It is very good tool and it works like wonders. And also in case of ankle sprains, where there is anterior movement of your lateral malleolus of fibula, and it activates the endogenous analgesic system. It increases the range of motion. It reduces pain and thus causing reduction of inflammation. And you succeed in your treatment if you're using it for the rehabilitation purpose. And how it supports the muscle, if there is any strain, if there is an event the next day, you can use it, a day before. What I personally prefer is I put it as an inhibition thing, especially in the case of quadriceps and hamstrings. And just before the event, I preferably go for a facilitation technique so that they have an extra push in the muscle and the movement of the athlete is better. I have used it, broadly in 200 meters and meter athletes. Okay, and removes the congestion. It is useful when you have a grade 1, you can say muscular sprain. So in that case, it is very useful. You can use the web cut taping and you can remove the swelling on day one. After that, you can go for the rehabilitative part. Okay. Next one, this is something, I have always worked upon. Like you can use a collaborative knowledge of other skills and techniques along with the taping for better results. Like, first of all is the biomechanical correction. That is, I have used extensively in the cases of flat-footed individuals, where you can work on the hallux valgus, which I'll be discussing later, and you can work on improving the arch, and you can reduce the tension in the calf muscles and the shin areas, thereby providing the biomechanical correction. And also you can go for this rotational force at the shin area so that the rotation of the tibia gets back into place. And myofascial releasing, yes, for sure. As Thomas Myers has said, that muscular strain is applied along the traceable myofascial lines. Because as you must have studied this MFR, there are 3 to 4 facial lines we work on. Number one is the lateral line, which is very useful in case of IT band strains, IT band tightness, vastus lateralis strains, and VMO weakness. And also those posterolateral facial lines, which goes all along your mid back, your obliques, and it goes down there. You can use it for you can use it for like medium pacers, because they usually have a stiff back and it works very well. You can use the technique of web cuts on your obliques. It helps a lot. And yes, mobilization techniques, it's one of the most favorite thing I like to do, because I am a Mulligan practitioner. So I use it along with Mulligan's technique, that is MWM, movement with mobilization. And also if you are practicing Maitland's or Cyriax, you can collaborate it along with that. It has very good results. And then muscle energy techniques. In case of BLR, if you're giving for hamstrings, like bend leg raises, if you have used it, you can give BLR after the technique. If the player has to go for a match, or they have a bout, or they have any event, you can go for a facilitation taping of hamstrings along with that. And also you can provide a web cut where you can take the load off the hamstrings and you can go little bit laterally. Now next, as you can say, this particular picture, she is a basketball player and she had come to me on next day of a game. She told me that she had a lot of pain and stiffness in her trapezius after the match, and she was feeling as if something, some load was put on her shoulders. So what I did, I took off the load from her trapezius. As you can see, I've split the tape in middle. There were 4 blocks I used, and I took off the load at C6, C7. I created some space and she felt better. Along with that, I have just used 2 cups here those were on her trigger points. You can use as many cups as you want, but these were her trigger points, so it worked like anything for me. And she was 40 to 50% better after her first session. And as she went for a basket, after that she had a lot of trouble going back and dodging again, but she continued because it was a crucial game for her. So you can use with cupping, you can use it with needling. Instead of cupping, you can also put needles, and you can put the kinesio tape during the treatment. As I said, treatment tool. It is a very good treatment tool. After the session you can use, but during the session also it is very helpful. And as it is a washable tape, you can put ice packs over it. You can go for cold packs, or you can go for heat therapy. It doesn't affect. And hydrotherapy, if you have got to take some pool sessions, you can wear this tape and go for it, because the wear time is good. That is 3 to 5 days. And as I said, it has got immediate and long-term responses. And immediate was in this case which I came across with, and she was quite happy with the treatment. Now moving on, I always follow this myofascial lines principle, which says that muscles, they act in synergy, not in isolation. So if you are treating any particular joint, please work on the agonist, antagonist, and synergist muscles for sure. Because for example, shoulder, not always a single muscle works. It's always a synergist muscle and some antagonist muscle working all the time. So you should work on all the muscles. Like if you have a deltoid strain, you can go for an inhibition taping of deltoid. Along with that, you can work on enhancing the other rotators so that they take off the load from the deltoid muscle. In this case, I would like to mention that I prefer of like anterior to posterior taping, which is like I cut it in 4 to 5 pieces. And what I do, I put one anchor on front of the shoulder that is just below the uh, like greater tubercle and just 2 inches medially. And then I go backwards and downwards, like inferiorly, and give it like support tape along with deltoid inhibition taping. It works like anything. Or also, if you want to use pectoralis major taping, that also works very well. As you can see in this picture, this line is coming, it is going above the deltoid and then it is coming inferiorly and medially. So you can make use of it. You can, try these myofascial lines and it will work for you as well. And as it is stated in this book, that muscular strain is applied along the traceable myofascial lines. And movement becomes a habit, which becomes a posture, which becomes a structure. So you have to make sure that they don't do a wrong movement. You have to guide the person always. I'll be showing few pictures later in which, nowadays, because we are in lockdown, a lot of people, they're using their mobile phones for, binge watching, and they don't realize the postures they are in. So it has become their habit. So this tape also works, it gives some signals in keeping your posture upright, because, tactile stimulation works better than sometimes, hearing, tactics if you use. So because it is there all the time, they know they have to work on it. Next. Now the best results of taping in sports, what I have used intensively on is ankle sprains. Mostly, I've used it on ankle sprains rehabilitation in all the stages, acute, subacute, and chronic. And then shoulder muscle imbalance, which includes muscle strains, grade 1 tears, postural issues. And as I just told about muscular imbalance in shoulder injuries, also I've used it in CP patients, cerebral palsy patients a lot, because they have got, hypertrophy of muscles, and their muscles are always, overactive. So you can use it, as an inhibition method. Now, knee issues, specifically IT tightness, patellar tracking, chondromenacia patelli. I'll be talking about it later. And shin splints, yes, shin splints I would like to mention. Basically, in shin splints, the shin area is usually tight, but what we miss on is usually people who have low arch or collapsing arch, they usually have shin splints pain. And also you'll find a lot of calf muscle tightness. So you can go for, calf releasing, myofascial releasing. After that, you can go for an inhibition taping because calf is overactive. And you can go for a crisscross taping on shin splints, which you must have learned. Like you take the load off the medial portion and you take it upwards towards the lateral portion, and then you go from inferolateral to posteromedial portions. You can go crisscross. It has worked for me, and I hope it works for you as well. And then muscular strains. Specifically in hamstrings, adductors, quadriceps, I have seen these are the most, recurring injuries which athletes, they, complain of. For hamstrings, one thing I would like to mention here, like in runners especially, you should never ever go for an inhibition taping if they have to go for an event. That is my personal experience, because if you go for an inhibition taping, they need a push from the hamstrings. If you go for an inhibition taping, it will put more strain on their muscles. So rather facilitate the muscle, and as they get back, you can use your other techniques and other, skills to, relieve their pain. But for an event, it's better if you go for a facilitation taping. Now, adductors. Adductors, along with adductors, there is usually involvement of rectus femoris. In 90% of the cases, I have seen that. So for this, I don't go for a usual taping. I always prefer going for web cuts, longer ones like minimum 6 to 7 blocks, and I go, start from inferomedial area, uh, just close to the groin area, and then I go inferiorly and laterally, splitting it in 4 parts and going just above your patella and ending it towards the IT band. And the outer portion, I start just closer to the greater trochanter, put your anchor there, leave 1.5 blocks up and split it in 4 pieces. You can come in from outwards to inwards. You take off the load whenever it is required when they'll be going for a push, because suddenly when they start, when they, take a start, they need a lot of, load to be lifted up. So it helps a lot. Okay. Now, as you can see, hallux valgus. This is most common in flat-footed individuals. Otherwise, also like in general population, you'll come across in cases of rheumatic arthritis and gouty arthritis patients. They have this, this is a very common complaint. And also, during their developmental years, young adults, if they don't work on their arches, they have this collapsing arch trouble. So in this, what you have to do is, in the left picture on your left, what you see is, I am pulling the great toe towards me, and the patient can be in a long sitting or like supine position as they're comfortable. You can put a pillow underneath their knees for relaxation of muscles. Otherwise, long sitting also works quite well. So you can lift, pull this great toe towards you. You can take 2 blocks of this tape, split it in middle, and always remember to cut the tape in the length of the tape. Never go in the transverse direction, because there will be lack of stretch you'll be feeling. So what I have done here is, I have put, one end of the tape anchor on the inferior side of the first MTP joint, and then I have lifted the tape up and finished it on in between second and third toes, as you can see here. Okay, this I have done for correcting the joint place. And this black tape, what I have used is, I have given a facilitation technique. I have gone from proximal to distal, and I've used the end portion of the muscle. You can use it above also. You can use it for extensor digitorum. You can use it upwards TFL and all. You can work simultaneously on that. But I have used it. This has worked for me. And along with this, if there is more collapse of arch, what you can do is, you can put an anchor. You can take 3 to 4 blocks of the tape. You can put an anchor on the sole, and you can lift it up, go superiorly and laterally towards the ankle joint to maintain the arch. This has given me very good results. And yes, one of my favorites, as I was talking about the hairline fractures, first I'll explain this. This is, what I use is, this is Mulligan's technique, movement with mobilization. What I do is, we usually give a posterior glide at ASIS. And what happens is, you have to use minimum 6 to 7 blocks of the tape in this. And initial, as you can see, 1.5 blocks, please do not pull the tape, let it be on there. You just go medially 2 to 3 inches to the ASIS, and then you pull this strip out and you go behind and you follow the iliac crest, and you cross the ipsilateral SI joint, and you finish it just before the contralateral SI joint, in between both the joints. And if you want to cross it, but you have to make sure that you don't pull the ends, you leave it like that. It has worked quite well along with MWM of the hip joint. And just before the event, I used this tape, and this works like anything if they have pain going down the adductors, and if it is going down the hamstrings. Along with this, in 90% of the cases, you'll come across with hamstring tightness for sure. So what you can do is, you can use BLR technique for this, like bend leg raises or MET, whatever you're comfortable with. So I'll share some experience of football. And there was a goalkeeper. She was in the goal post, and then the ball crossed her. Just to grab hold of the ball, she just turned around and she hit the goal post. And I was on the other end of the goal post. I could hear this sound, and she just collapsed there. Later on, when we took her to the hospital, she had fractured, her ilium bone, and it was so painful. There is no plaster, no pop can be put there. She was asked not to put any weight on the right leg because it was a right side ilium bone fracture, and she was immediately sent back home. Unfortunately, she had to miss the tournament, and but I didn't know what to do, so I just tried this tape. I was just into 1 or 2 years of my taping experience, so I just tried this. I put it on. As she went back, she gave me a feedback that till the tape was on, she felt much better, and it helped her a lot, in keeping it in place. Later, unfortunately, she did not have the access of getting herself taped again, but somehow she recovered. But you can use it for hairline fractures of hip bone, or fingers. I've used it on fingers. I've used it on chip fractures of uh, phalanx. I have used it on hairline fractures of radius and ulna. I have used it extensively until you get some POP support. Okay, now moving on to neck strains. Now, in this, I use Maitland's at times, and if the individual is younger, I go for Mulligan's, snags and nags. I'm not sure if you're aware of snags and nags. Let me clear it for you. Nags is natural epiphyseal glides, and snags is sustained natural epiphyseal glides. As you can see in the left picture, he has sustained it because you're putting a pressure and you ask the person to extend the neck, and you repeat this for 10 movements or 10 times, and then you ask the patient, you reassess, always reassess. And if the person is comfortable, this particular person, again, she was a basketball player, and after basket, she had a recoil reaction, and she suddenly went into flexion and a sudden extension. She had a lot of pain. So along with other things, because I tried, nothing was working, so I used Mulligan's. And when you give Mulligan's, it is good, but you want it to stay further. So I didn't know what to do, and I did not have an available Mulligan's self mobilization belt. So what I did, I used the back of this tape, this paper, just put usually at the back of the tape. I rolled it. It is about 1 centimeter in length, and width is about 2 to 3 mm. I put it in between the epiphyseal regions, and I kept it there. I put the tape, and then I reassessed. She felt much better, and I did it for 5 days in a row. And after 5 sessions, she was much better because I was able to see her every day. So this worked for me. If you're not able to see the player every day because of long distance or some other issues, you can put double tape, like one single tape, and you can put just one more tape which is an half a centimeter above it, and you can go across. And this is a very good treatment tool, as I was talking about. It works like anything because I didn't have any other way. It's just some kind of trick I used. It worked for me, and you can use your knowledge and experience for this. Okay. Now, yes, another very good example is ankle sprain. In this, I have used this posterior gliding of lateral malleolus, but it works till grade 1 or 2. I am not sure about results beyond grade 2 because for those, I did not allow the player to go for a match and was on complete rehab. This I have used for grade 1 to grade 2. As you can see in this first picture, it is a posterior and superior glide if it is grade 1, but not on the day of injury, after 2 to 3 days of injury. I'll repeat it again, not on the day of injury, you repeat the oscillations. You just do it once if it is very important or a crucial event. Or if it is in general population, please do not use it. Avoid using it if it is not important. So in this first picture, there is this posterior and superior glide. So you can give 8 to 10 oscillations. And if the player has to go for a match, you can use these, 3 blocks of tape, split it in middle, and do not forget to round off the edges because otherwise the tape may come off. And you put in first anchor just 1 to 1.5 inches, anterior to the lateral malleolus, and you do not pull the tape there, no tension on the edges, and you pull it backwards and posteriorly and superiorly a bit, just diagonally you can use it, and you finish it off just behind the medial malleolus, and it works very well on ankle sprains. Along with this, if it is just grade 1, if they have good, in case of footballers, they usually have ankle sprains at least twice or thrice in their career. So for them, they usually have this habit of putting on crepe bandages, and even now it is common in cricketers because of this fast format of game which is set in. So for that, I use cohesive over it. I put the ankle in neutral position. I prefer getting it back to the neutral position. I put the tape in figure of 8 pattern. Along with this is a mandatory thing which I practice always. And on your right, the third picture, it is like giving oscillations. In this, they are using Maitland's plus Mulligan's. They're pulling it down and they're pushing it. This is giving oscillations. You can use it depending upon your skills. Next, now this is tennis and golfer's elbow. In this, what I have given, this is a picture of tennis elbow. I have not put any picture of golfer's elbow, but I'll be explaining it now. You can put an anchor just anterior to your radius head, and then you give a posterior lateral glide or a posterior glide to radius, and you go upwards and backwards behind the elbow and finish it off there. I preferably cover the pointed part of the elbow so that it gives a good anchor, and it works very well. There is immediate effect of it, and players and patients, they say that they are immediately relieved of pain. But along with this tennis elbow, as you know, it is an overuse injury, so preferably you should use your other skills of I would say I prefer dry needling a lot, and also along with this you can use facilitation taping for your extensor digitorum. FDP, EDP you can use, and you can use this, starting from the, the common extensor origin. You can go till your, mid palm or your fingers. You can go up till your distal phalanx, depending upon the extensivity of the injury. That is your personal choice. This is just, to show. Unfortunately, I did not have the pictures of my complete taping, but if anybody wants to know, you can drop me an email. I'll try to find out the pictures later for you. Okay, and for the golfer's elbow, you go, the opposite way. You have to give a posterior glide to ulnar head, ulnar process, and then you just, go medially to laterally, going, posteriorly, and finishing it just behind your radial head. And also for golfer's elbow, you can give an anchor, as you can see my hand. You can start from the mid of your arm medially, and you can end a tape the mid of your forearm, and you can give a medial support. It also works very well. Now the wrist strains. These are very common, and I have seen early degenerative changes in their late 20s and early 30s. Basically, it is common in golfers and cricketers, because when they do cocking and uncocking of wrist during their shots, so they have their carpal bones overused, and many of them, they have shown early degenerative changes. So for the left one, this is basically for interosseous ligaments. There was strain, so just to keep it intact, I've used this tape. This is just finishing it off. Also, you can leave some space in middle so that you don't stop the blood or lymph circulation. And the middle one, this particular case, she had a ligament sprain along with carpal degeneration. For this, I have given a medial support, starting from the ventral side coming onto the dorsal side, and also these ends which are going. This is an inhibition taping I have used, starting from the middle finger and going just above the wrist, and on the middle finger as well. because she had some pain of, she had some nerve irritation as well. It was clear through her MRI, and she had some tingling sensation going towards the, medial side of her wrist. So this worked for her, and but I had to remove it immediately because after, a wear time of about 3 to 4 hours, she complained of some numbness because definitely we were putting a lot of pressure in there. And going to the third picture, as you can see, this kind of taping is very effective if there is any, sudden jerk or, like overextension of your of the thumb, or dequerens disease. What you do is you go round the thumb and you go up. You take the load off the thumb, and also one portion comes medially on the ventral side of your forearm, and this is kind of inhibition. This has also worked well for me, when holding a bat or hockey. It works very well. You can use it. Along with that, it's your choice of using any other cohesive or cream bandage over it. But if you can do it really well, you don't need any other support. Now next, finger and toe injuries. They are very tricky ones, and it is quite difficult to, treat because every time you cannot stop the movement. But in this particular case, this left one, she had hit a, PIP joint, DIP joint. So it was like, transitional force she felt. So in this case also, I have used my knowledge of MWM again. I just gave grade 1 of it, and she was better. So I taped it in the same direction, like I gave an outer rotation of the distal phalanx, and I have used it, and she was much better. This is for immediate relief. And one thing I would like to mention, this is not a definitive treatment, but this is, some preventive measure which you can use. And on this right side, this was useful for, bowlers when they had a lot of pain, by holding the ball. So this particular muscle was, repeatedly, being worn out, or they had a lot of pain and gripping. So what I did, I have not put the picture of it, but I'll explain. I taped the medial part of the index finger, and also I used this, I'll go to the previous slide, this thumb taping I used along with that. But you have to take permission from the referee or the umpire for this, or you have to use the same color as the ball or whatever, sport is, with prior permission, as sometimes it is not allowed. In cricket, it is not. So they can remove it just before bowling, and otherwise they can keep it on. There was another very interesting taping I did, which was, there was splitting of index and, middle finger. So there was a lot of strain being put on, this index, in between the index and the middle finger. So I went for a figure of 8. I split the tape in 4 pieces, 2 blocks, and I used it figure of 8. I allowed full movement. I just blocked the end 10 degrees of movement, and there was no pain, and it was pain free, and it worked very well. So as I said earlier also, you can use your knowledge and your biomechanical corrections, and this taping helps. Now moving on to postural corrections, as I was talking about, during this lockdown, everyone is suffering from this. As you can see in this picture, this person is working on laptop. So usually it is human tendency that you're so engrossed in your work that you forget how you're sitting, if you're maintaining your posture or not. In this particular case, you can give a rhomboid, pull, and also you can go for a trapezius lift off taping, and also you can go for like posterior gliding of the humerus head. In this particular case on your right also, this works like anything because this person seems to be, with a forward neck posture. But I would ask you to go for some stretches or releasing in this particular case. And also he'll be needing a lot of taping, correction, subscapularis. As I can see, this, small capital muscles are also involved. You can work on all those with your knowledge. And this is quite common when we are walking on road these days because of thanks to the, mobile intervention. We have all lost, control of how and where we are walking. So you can use your skills for this as well. Now, moving towards the end part, and the precautions to taping should be done under strict guidance of an expert and should not be applied under the following circumstances. Please do not apply it on your own unless you have some supervision and you have learned it correctly. That is my suggestion. And for physios and all those, chiropractors or trainers, if you're using it, please always assess before and after taping, which it is mandatory, because people I have seen, they do not assess after taping and they just ask the person to just go, and as they reach back home they have symptoms of numbness and increase in pain. So make sure you do not make such a blunder. And injuries requiring more than tape can provide, as I mentioned, more than grade 2 tears or ligament sprains. And when taping is excessively, restricting the range of motion of a joint, predisposing the athlete to further injury. Like if you block a lot of movement and when they're going for their event, like I mentioned about, inhibition taping of hamstrings, please do not, overdo it on a muscle or do not stop the range of motion. And I'll mention it again here. Please make sure you do not go for an inhibition taping for, if you're taping for an event, for an athlete. Make sure you go for a facilitation. This is my personal experience of 9 years, what I've come across. And if the part is inflamed, make sure you have tested, for any skin allergy or anything, and there is no superficial inflammation which is not, adding on to their injury. Avoid taping on any cuts, lacerations, abrasions, or blisters. And also, sometimes tape may cause all such things. Make sure you inform the patient well in time, and also the necessary actions to be taken. Some anti-allergic powders or any ointments you have to guide them with. Yes. And in the end, I would like to discuss some researches. Like the first one, as I said, patellofemoral pain syndrome. And the results showed kinesiotaping can reduce pain and improve the ratio of VMO and VL. As I said, as you go for a medial, gliding of patella and you go over it, you take off the load from VMO and you take the strain off from VL and you put it in a better advantage position. And the tracking, if it is treated properly, can result in betterment of your quadriceps strain. And specifically in case of chondromalacia patelli, it works like anything. When patients, they have problem in descending stairs, strengthening of quads, and static and dynamic balance test, patellar stability. Yes, very important thing I failed to mention before. It works very well in proprioception and joint sense. So as it is written, decreased pain and increased joint position sense. If you can make them better in their sense of joint, it works on ankle very well if you're using trampoline or balance boards, and it works very well in case of knee as well, in ACL tears, post ACL tear surgery rehabilitation and reconstruction surgery when they go for. After that, it works very well. And now the second research is about the short-term effects of cervical kinesiotaping on pain and cervical range of motion in patients with acute whiplash injury. As I gave you an example of neck strain, it has an immediate improvement, as I told, decreased pain. So you can use it, and it reduces inflammation also by putting those small, epiphyseal joints back in place. You can use mobilization along with that. So coming on to the end of it, if there are any queries you would like to talk about, you can just ask me now, or else you can post it on YouTube, where you will have this video available later. And you can drop an email at dr.khyati@aol.in. I repeat, dr.khyati@aol.in. Are there any questions?